Good afternoon, ladies and gentlemen, and welcome to the launch of our clinical trial network in diabetes. So firstly, to congratulate Peter and Martin and Martina on the launch of the Institute. And I think anybody in the audience who hasn't been invigorated and motivated by the last 2 days should probably not be in the audience. So I'm certainly invigorated and motivated and look forward to working alongside Peter and the team in delivering the ambition of the Institute. I think we're very fortunate that we're launching the clinical trial network in diabetes at the same time, because our network has a great expanse of people with a large skill set, and I think working alongside the Institute, we will have areas where we can combine our efforts and areas where we can learn from one another. I'm very grateful to the HRB for giving us the funding for the clinical trial network, and just to make it clear, the funding is to develop the infrastructure, to build up the processes, to educate people, but the network is open for business. So anybody who wants to do a trial or a piece of work, we're here to support you going forward. So in the audience, we have all our investigators, or some of them, our collaborators, but I'm really pleased to have 3 patients here in the audience in the front row, Christine, Carmel and Helena, and they're going to be joining our panel discussion. So to start the ball rolling, am I going forward? Yes. So why do we need a clinical trial network in diabetes? Well, I don't have to tell you that diabetes is a big global health problem. Heart disease is one of the leading causes of death globally. Musculoskeletal disease gives a lot of morbidity, but diabetes is a huge player. So in 2013, there were about 220 million people with diabetes, but by the time we get to 2050, that will have risen to 480 million. As Robert Watts says this morning, and I was delighted to hear that he was able to produce this information, diabetes is very costly to the state of Ireland. At the moment, we're spending about €1.4 billion per year on diabetes, and that represents about 6% of the total health budget. What is really disturbing for me is that 50% of that 1.4 billion is spent on preventable complications. And that's really shocking indictment of what we're doing in the country, and it's something that I think that we need to work on. Now, how can we reduce complications? By using our research to look at prevention strategies, early detection strategies, and better glucose management strategies through new therapies and new technologies for monitoring care. So in the Irish context, the prevalence of diabetes is about 6%. That means 1 in 10 adults have the disease. The majority of diabetes in our country is type 2 diabetes, which represents about 85%. About 15% of the total number is type 1 diabetes. As I said, complications are very common. And the cost of care is also driven by the following 3 facts. If you look at people over the age of 50 with and without diabetes, the diabetes cohort are 87% more likely to attend outpatients. They're 52% more likely to require inpatient care, and they're 23% more likely to require ED care, emergency department. So if we can deal with improving care, reducing complications, we can reduce this and have huge cost savings for the health budget. And hopefully that can be then used for other things. So how can we rise to this challenge? Well, there's groups of people trying to deal with healthcare, there's other groups of people trying to deal with policy, but I think that we can really rise to this challenge through research. So with this money from the HRB, if we can build a national, cohesive, collaborative network, it will help. We must align our research to the clinical care programme, and I'm delighted that the leader of our clinical care programme is one of our members of our network and is also here with us today. And that will allow and facilitate rapid translation of our findings into clinical practice. Thirdly, harnessing the contribution of people and charities, and we heard that over and over again over the last 2 days. We have to have people and we have to have patients from the very beginning. Delivering affordable solutions, because not everything has to be expensive. That's really important. Strengthening our industry partnerships, and then through all of that, trying to innovate new technologies, new medicines, new processes for diagnosing, and also, I think, new processes for delivering care. And we have the baseline for that from the Sláinte Care in the ECC programme. So when we started putting the grant together, for which the HRB gave us money, we took 3 health regions, Galway, Dublin and Cork. We took the health system there and the academic and research networks attached to that, and that was our starting point. Our vision is to improve the health and well-being for all patients with diabetes through research, and we have 3 objectives. 1, improve health and well-being. 2, become sustainable and self-funding, because you have to make your own money to survive, and then to train and educate future people in the area of clinical trial methodology across disciplines. So we got off to a pretty good start. We have a robust group of PIs and co-applicants on the island of Ireland, which is really important. We're linked to universities, CRFs. We have a number of clinicians. We're being helped by a number of international collaborators. We have collaborators in nursing and dietetics, involvement of charity and industry. We're linked to the National Clinical Care Programme, and more importantly, we have embedded PPI. So what are the strengths of the network as it currently stands and the strengths going forward? Because it's an all-Ireland network, this is really important. It gives us access to 6 million people, and that, based on a 6% prevalence, is about 360,000 patients with the disease. Through funding of the HRB primary care network, we have access to our general practitioners and patients through that route. We're aligned to the clinical care programme. We have strong biostatistics and methodologists as part of our grouping. We're linked to CRFs, which have track records in delivering large clinical trials. We have partnership with charity, strong industry partners, and a focus on education and training. So the added value, I think, of a clinical trial network and using the resources or using the financial resource that has been given to us will be in areas like support for grants and papers, giving us a group of clinicians who can help to deliver trials, a group of research nurses for regions, hopefully, collaborative expertise, and then the focus on education. So a lot of added value coming from a network where you have some start-up monies. I think there's a lot of benefits for industry, and I would hope that we as a network nationally for diabetes will be able to do timely feasibility assessments for new studies, access research experience that the industry partners may require and key opinion leaders, rapid identification of study sites, timely activation of the study sites, rapid recruitment, and above all, making sure that the data we're collecting is of high quality. I think this network over time, if we were to look 10 years from now, I would hope that the network has a huge impact on diabetes research in improving the coordination of the research, the speed at which the research is completed, the quality of the data that we're collecting, the integration into clinical practice, and expanding participation in research. So it's no longer good enough to just recruit your patients in a level 4 hospital. We need to get to the level 3 and out into the community and GP practices and the ECCs. So hopefully over time, this network will have a huge impact on health and society. It will improve patient care, reduce hopefully healthcare costs and length of hospitalisation, create jobs, I hope, through commercialisation and TTO, contribute to the workforce development, and overall improve public awareness for diabetes. We will have a strong focus on education and training because we must build capacity. So people like me will be gone in 10 years. It's up to people like me to train the next group of people going forward so that the cycle of events can continue. So we have started our connection. We're still in our infancy. We need to connect more. So I hope that people in the audience here, whether you're from industry, whether you're a patient representative group, the HSE or a CRF, that we can all combine forces and work together, remain connected and move the agenda forward. So diabetes is a common disease. It has implications not only for the patient, but for society, the amount of health care that we need to give and the cost of the health care. So it does have an impact on the Irish economy. I think the network is now positioned to facilitate change through research, and really we are open for business. And after 5 or 10 years, I would hope that Ireland will have become the country of choice in which to do multi-centre trials, and that we're open and transparent so that everybody is welcome to the network if you have a good design, or you have a good trial that you want to do, or even a question answered. So thank you very much for your attention, and I look forward to working with you all.